All right, so our first part of our ethics and culture unit is going to be just a very brief discussion on ethics. So, ethics, by definition, are a set of principles that will look at what is morally right or wrong. More or less, this is giving us a standard or code of conduct. So, we as healthcare professionals are able to look at, analyze, and review information in order to make decisions based on what people believe are right and what is good and proper conduct. Now, in healthcare, there's never going to be a shortage of potential ethical dilemmas. For instance, these are just a few, but should someone have the right to euthanasia, which is assisted death or physician assisted suicide, if they are terminally ill, so they are going to die and they are in excruciating pain? There are some states that allow physician assisted suicide. It is not an easy process. It requires a relatively lengthy um, review and assessment. You have to get signed off by two physicians. I believe you have to see a mental health provider, but it is
Mr.
allowed.
Polinsky, if you're still on campus, please call extension 1000. Mr. Polinsky, if you're still on campus, please call extension 1000.
It is still allowed in certain parts of the United States. Um, Second, should the patient be told that the healthcare provider, so their nurse or doctor, has AIDS? Why or why not? Why would that make a difference? When should we look at discontinuing life support? So, if someone is on a breathing machine to keep them alive, when is the time to take them off and either let them pass or see if they are able to sustain life on their own? And not only that, but who makes that decision? Is it the parent? Is it the spouse? What if there is no family? When and how do we decide? And then the final thing to consider is, do parents have a religious right to refuse a life saving blood transfusion for their child? So, Jehovah's Witness in particular, as a religion, they do not accept blood products, which is their right to choose. Now, how does that apply when it's someone making the decision on behalf of a child? These are things that we have to think about because some of us might have very strong feelings one way or another. And how do we kind of find the middle ground for what the patient wants and then what is ethically the right thing to do? There are going to be some
Watson, if you're on campus.
there are going to be some places like professional organizations that have guidelines that give us kind of a good understanding of how to deal with certain ethical dilemmas. So there may be a specific code that you're required to follow. If you're in a professional organization, they may have an ethical code, which could be difficult with some of those situations we just talked about. We might see some of these things kind of change or differ area to area, but it's going to be relatively the same principles. So let's talk about some of those ethical principles. Ideally, we're putting the saving of life and promotion of health above everything else, which is where it gets really tricky when we're looking at things like physician assisted suicide. How are we putting the saving of life above everything else if we're agreeing that people are allowed to end their life? We're making all efforts to keep the patient as comfortable as possible and again to preserve life when possible. Here we see that we're respecting the patient's choice to die peacefully and with dignity when all other options have been discussed. Or if the person has some sort of advanced directives like a do not resuscitate or a living will that requires or requests that no life saving measures be taken. Sometimes this can be difficult, but we do need to remember to treat everybody equally. It doesn't matter their race, their religion, their socioeconomic status, their age, their nationality, or, which we discussed a little bit in our last unit, why they're there. It doesn't matter if they are the victim of the crime or the person that did the crime. We need to treat them all the same. You are always supposed to and have to provide care to the best of your ability. So, no giving it just half effort. And you are required to maintain a competent level of skill. So if you are CPR certified, you are required to get that certification updated every 2 years so that you are up to date on information, you are getting that continued education, and you are making sure you're able to provide for your patients. You have to maintain confidentiality. So, again, not sharing information with anyone that's not able to get it. We have to keep any information about the patient private. It's only to be shared with other people in the healthcare team. Otherwise, you can suffer legal ramifications or fines. And we are never supposed to or should use that information from the patient for personal gain. Gossiping about patients really is an ethical issue. It's not your business, and it's not your business to tell anybody else. So we need to make sure that if we're coming across or seeing any of these immoral, unethical, or illegal issues, that we're reporting them to somebody. If you know about something and you don't report it, you could be legally responsible as well. Make sure that we have a positive attitude, we're not having any negative comments, and we're showing that loyalty to our patients, our coworkers, and our employer. This goes back into those personal qualities we talked about. This lets people know that you can be dependable. And then finally, be sincere, be honest, be caring. You've probably heard this from your parents or someone in your life, but treat others like you want to be treated so that we are giving that respect, that concern, and dignity to allow people. Remember, they're going to be vulnerable when they're with you, but to have the best experience that they can no matter what the issue or situation is. So like I said, just a very brief overview of ethics. If you have any questions, let me know. Otherwise, I will see you next time for culture.